Have you ever felt the sting of being dismissed, your voice silenced by someone who believed they knew better? Today's story ventures deep into the heart of pride and humility, exploring how the very foundations of our confidence can crumble in an instant, and how grace offered in our darkest moment can reshape everything we thought we knew about strength, wisdom, and the courage to admit we were wrong. Healing hands meet brilliant mind. Noelle Winters smoothed the front of her navy blue scrubs as she stood before the glass doors of Mercy General Hospital, watching the autumn rain streak down the transparent surface. 27 years old, with dark hair pulled back in a practical ponytail and a small silver cross resting against her collarbone, she carried herself with quiet confidence, born not from arrogance, but from experience, earned in places most medical professionals would never venture. Her brown eyes held a depth that spoke of nights spent in rural clinics with failing generators, of children saved with improvised equipment, of prayers whispered over patients when medicine reached its limits. The electronic doors hissed open, and she stepped into the pristine marble lobby, a world away from the red clay roads and tin-roofed medical stations of the countryside she had left behind 7 weeks ago. Everything here gleamed with efficiency and wealth. The air smelled of antiseptic and fresh flowers from the massive arrangement dominating the reception desk. Her worn sneakers, resoled twice, squeaked softly against the polished floor. "Nurse Winters?" A crisp voice called from behind the tall desk. The woman wore a tailored suit that probably cost more than Noelle's entire wardrobe. "You will be assigned to the 4th floor surgical ward. Dr. Graham Aldridge's team. Report to Station 12. Noelle nodded her thanks and headed toward the elevators, her stomach tightening with a mixture of anticipation and something else she could not quite name. She had heard of Dr. Aldridge during her orientation. 34 years old, top of his class at Hopkins, 3 years running as the hospital's most successful surgical resident before being promoted to attending, published in 7 major medical journals, considered brilliant by every metric the medical establishment valued. The elevator chimed softly as it rose, and Noelle closed her eyes briefly, steadying her breath. She thought of her grandmother's weathered hands, of the wisdom passed down through generations that had nothing to do with textbooks and everything to do with observing, listening, trusting instincts honed by necessity. She thought of the letter she had written to herself on her last night in the village, words penned by candlelight because the generator had failed again. When the doors opened on the 4th floor, organized chaos greeted her. Nurses moved with practiced efficiency between rooms, their shoes creating a rhythmic percussion against linoleum. Monitors beeped in syncopated harmony. Someone laughed at the central station, the sound warm and human amid all the technology. "You must be the new transfer." A stocky man with graying temples approached, extending his hand. "I'm Raymond Cho, charge nurse. Welcome to the jungle." D. His smile was genuine, crinkling the corners of his eyes. "Fair warning, Dr. Aldridge runs a tight ship. Brilliant surgeon, saves lives other doctors would give up on, but he does not suffer fools gladly. Or questions. Or suggestions, really." Noelle shook his hand, noting the calluses that spoke of years in the profession. "I appreciate the honesty, Mr. Cho. Just Raymond, please. We are all in the trenches together up here." He gestured toward a nearby desk where files waited in neat stacks. "Get yourself oriented with the charts. Morning rounds start in 20 minutes. Try to stay invisible during your first one. Dr. Aldridge likes to focus on the medicine, not on training new staff. He will notice you eventually, but it is better if you can demonstrate competence first." The advice proved prophetic. Dr. Graham Aldridge swept into the ward exactly 20 minutes later, white coat crisp and perfectly fitted over a blue button-down shirt and charcoal slacks. His dark hair was styled with just enough product to look effortlessly perfect, and when he moved, he commanded space the way a conductor commands an orchestra. Handsome, in that classic way that seemed almost sculpted. With sharp cheekbones and intense hazel eyes that missed nothing, he carried a tablet in one hand and a cup of expensive coffee in the other. 3 residents and 2 nurses fell into step behind him, like planets orbiting a sun. "Room 412, he said without looking up from his tablet, his voice carrying the cultured accent of old money and elite education. "Mr. Henderson, post-operative day 3 from exploratory laparotomy. Sepsis panel came back this morning. Talk to me, Dr. Patel." A nervous resident with thick glasses fumbled with her own tablet. "White count elevated to 19,000, sir. Temperature spiking to 103.2. Blood cultures pending, but we started broad-spectrum antibiotics overnight, per protocol." "And?" Dr. Aldridge stopped walking, turning to face her with eyebrows raised. "What are we missing, Dr. Patel? What is the clinical picture telling you beyond the numbers?" The resident swallowed hard. "Surgical site infection versus pneumonia, sir. Chest X-ray shows some haziness in the right lower lobe. Versus hospital-acquired resistant organism," Aldridge countered, already moving again. "Which means we need to broaden coverage before we lose him. Page Pharmacy. Switch antibiotics to vancomycin and meropenem. And get me a surgical consult for possible wound exploration. If there is an abscess brewing, we need to drain it before it kills him." They moved as a unit into Mr. Henderson's room. The man lay connected to multiple monitors, his face flushed with fever, breathing labored. Dr. Aldridge examined him with efficient precision, his hands moving with the practiced confidence of someone who had performed these assessments thousands of times. Noelle hung back near the doorway, observing but not intruding. She noticed what the others seemed to miss in their focus on protocols and lab values. Mr. Henderson's lips were cracked and dry despite the oxygen mask. His tongue, when he opened his mouth to speak, showed a thick coating. His skin had a peculiar texture, slightly waxy in a way that did not quite match typical infection. "Dr. Aldridge," she began softly, then stopped herself, remembering Raymond's advice about invisibility. But Aldridge had heard her. He turned, seeing her clearly for the first time. His gaze swept over her in 3 seconds, cataloguing and dismissing in the same moment. New, young. From some minor facility, judging by the worn shoes. Probably intimidated by the big city hospital. Definitely not worth interrupting rounds for. "Yes, nurse." He made it a question, not bothering to hide his impatience. "Winters, sir. Noelle Winters. I just wanted to—" "Unless Mr. Henderson is actively coding, Nurse Winters, I do not need interruptions during rounds. Please note his vitals and ensure the antibiotic orders are processed promptly. We have 12 more patients to see." He turned back to his residence without waiting for her response. "Moving on. Room 414, status post-coronary bypass." His voice faded as the entourage swept out of the room. Noelle remained for a moment, checking Mr. Henderson's IV placement, noting the way he winced when she gently pressed on his abdomen, away from the surgical site. She made a mental note and followed the team, staying well back now, watching how Dr. Aldridge worked. And he was brilliant, she had to admit. He caught subtle findings others missed, connected symptoms to underlying pathology with the speed of a supercomputer, made decisions with confidence that came from genuine expertise. He saved lives through sheer force of intellect and skill. He also ignored her 5 more times that day. When she suggested checking a patient's magnesium level based on subtle tremors she noticed, he waved her off without looking up from his tablet. When she mentioned that another patient might benefit from positioning changes to help drain fluid from compromised lungs, he told her to stick to following the respiratory therapy orders already in place. When she pointed out that an elderly woman's confusion might be medication-related rather than just post-operative delirium, he dismissed it with a curt reminder that nursing staff should execute care plans, not revise them. By the end of her shift, Noelle felt the familiar weight of invisibility settling over her shoulders. She had felt it before, in different contexts. The young woman from the rural clinics where they improvised with what they had. the believer who saw medicine as partnership with something greater than technique alone, the voice that spoke softly while others shouted. Raymond found her at the nurse's station, charting the day's observations with meticulous care. "First day, survival badge earned," he said, offering a tired smile. "Dr. Aldridge barely looked at you. That counts as a win." "Does he listen to anyone?" Noelle asked, trying to keep the frustration from her voice. "He listens to lab results, imaging studies, and other doctors with prestigious credentials. Nurses?" Raymond shrugged. "We are valuable for executing his orders, not questioning them. It is not personal. He treats everyone outside his professional stratosphere the same way, even when they might be right. Especially then. Pride is a funny thing." Raymond leaned against the desk, lowering his voice. "Between you and me, I have been doing this for 23 years. I've seen doctors like Aldridge before, brilliant, successful, and completely certain they have nothing left to learn from anyone they consider beneath them. Usually takes something catastrophic to shake that foundation. Sometimes even that is not enough." Noelle finished her charting and gathered her things. "What happened to Mr. Henderson after I left?" Raymond's expression shifted to concern. "Touch and go. The antibiotics aren't working as fast as Aldridge hoped. He is talking about emergency surgery in the morning if the fever does not break tonight. Why? You see something?" "Maybe. I am not sure yet." She hesitated, then decided to trust her instinct. "Raymond, if I write something in the chart, will it get to Dr. Aldridge?" "Depends on what you write and whether he bothers to read nursing notes, which is rarely. But it will be documented. If I am right, there will be a record that someone noticed." Raymond studied her with new interest. "You saw something on rounds, something Aldridge missed." "I might have. I need to do some research first. Make sure I'm not way off base. Can I access the medical library database from home?" "Use your employee login. It will work anywhere. But Noelle," his voice turned serious, "be careful. If you think there is something genuinely wrong with Henderson's diagnosis, you need to speak up through proper channels, not just chart it and hope someone reads it. What are the proper channels when the attending physician has already dismissed you 5 times in one day?" Raymond had no answer for that. Noelle went home to her tiny apartment, the one with the leaking faucet and the view of an alley, and opened her laptop. She spent 4 hours cross-referencing symptoms, reading case studies, checking against rare presentations of common conditions. When she finally closed the computer, it was past midnight, and she was certain of 3 things. First, Mr. Henderson did not have a simple surgical site infection. Second, if she was right, the antibiotics would not work, and surgery would make things worse, possibly fatally so. Third, Dr. Graham Aldridge would never listen to her, not unless something forced his hand. She pulled out a worn journal from her bedside drawer, its cover softened by years of handling. The pages held entries from her time in the rural clinics, observations and reflections written during rare, quiet moments. She found the entry she was looking for, dated 2 years earlier. The handwriting was hers, but younger, less certain. "Today I learned that true wisdom is not about how much you know, but about recognizing how much you do not know. Mr. Villalobos taught me that. He had no formal education, could barely read, but he understood healing in ways my textbooks never mentioned. He showed me how to read a patient's body like a map, how to trust what my senses told me, even when the equipment said something different. I was so certain I knew better because I had training, and he did not. Then he saved a child's life with a remedy I had mocked. I will never forget the look he gave me when I apologized. Not anger, just sadness that I had almost let pride kill a little girl. He said something I wrote down phonetically because I wanted to remember it exactly. She had underlined the next part. The most dangerous medicine is the one you think you already know everything about. Noelle closed the journal and looked at the cross hanging on her wall, a simple wooden piece carved by a patient's grandfather years ago. She whispered a prayer not for herself, but for wisdom, for the right moment, for the courage to speak truth even when it would not be welcomed. The right moment came sooner and more terribly than she could have imagined. She arrived for her second shift at 6 in the morning, the city still mostly asleep, the hospital transitioning from night to day with practiced efficiency. Raymond was already at the station, his face drawn and tired, in a way that had nothing to do with the hour. "Henderson coded twice overnight," he said without preamble. "They got him back both times, but barely. Aldridge is furious. He's pushing for emergency surgery in 2 hours. Full exploratory, convinced there is a hidden abscess or necrotic tissue they missed on the first operation." Noel's stomach dropped. "Did you read my notes from last night?" "I did. Hypercalcemia secondary to excessive calcium carbonate absorption, possibly exacerbated by vitamin D toxicity from overzealous supplementation. You think Henderson has been overdosing on antacids and supplements, and it is mimicking sepsis while also masking as surgical complications. Not just mimicking, it can cause actual life-threatening complications that look exactly like infection: confusion, fever, elevated white count, abdominal pain, kidney dysfunction, everything he is showing. But antibiotics will not help, and surgery could kill him if his calcium levels are high enough to cause cardiac arrhythmias when they put him under anesthesia." Raymond ran a hand through his graying hair. "Did you document your suggestion to check ionized calcium levels?" "3 times in my notes, with references to case studies. I know I'm just a nurse, but—" "Stop that!" Raymond's voice was sharp. "You are a nurse with eyes and clinical judgment. The problem is not your credentials. The problem is Aldridge's ego won't let him consider that he might have missed something. Then we need to find a way to make him consider it without making it about ego. Good luck with that. He is in surgery now, finishing up a procedure before Henderson's operation. He will be out in 40 minutes, then straight into the OR again, unless something stops him." Noel made a decision. "I need to talk to him. He won't listen. You know that. Then I will make him listen. I will follow protocol, go through the proper channels, document everything. But if Henderson goes into that OR without someone checking his calcium levels, he might not survive. And I will have to live with knowing I stayed silent because someone with better credentials dismissed me." Raymond looked at her for a long moment, then nodded slowly. "I will back you up for what it is worth, but be ready for fallout. Aldridge does not like being challenged, especially not by nurses he has already dismissed." Noel spent the next 30 minutes preparing. She printed studies. She gathered Henderson's lab work, highlighting the subtle clues others had missed. She reviewed his home medication list, finding the excessive calcium supplements and antacids he had been taking for months. She built her case brick by brick, fact by fact, knowing she would only get one chance. When Dr. Aldridge emerged from surgery, still in his scrubs with his mask dangling around his neck, he looked exhausted, but grimly satisfied. He was reviewing something on his tablet, already mentally preparing for the next operation, when Noel intercepted him in the hallway outside the surgical wing. "Dr. Aldridge, I need 30 seconds of your time about Mr. Henderson." He did not even slow down. "Already discussed with the team. We are proceeding with exploratory surgery. The infectious disease consult agrees with the plan. Unless you have new lab results I am not aware of, Nurse Winters, I do not have time for this conversation. I have a diagnostic possibility you have not considered. Please, just 30 seconds. I have considered everything relevant. Henderson has sepsis from an intra-abdominal source. We need to find it and fix it before he codes again. Now, if you will excuse me, I need to prep for surgery." He moved past her, and Noel made a choice that would change everything. She stepped directly into his path, not touching him, but making it impossible for him to proceed without physically pushing past her. Around them, other staff members slowed, sensing confrontation. "Dr. Aldridge, with all respect, if you operate on Mr. Henderson right now without checking his ionized calcium level, you might kill him." That stopped him. He turned to face her fully for the first time, and his eyes were cold. "Excuse me?" "His symptoms are consistent with severe hypercalcemia, not sepsis. The fever, confusion, elevated white count, abdominal pain, all of it can be explained by calcium toxicity. I reviewed his home medications. He has been taking massive amounts of calcium carbonate and vitamin D supplements for months. If you put him under anesthesia with critically high calcium levels, he could develop fatal cardiac arrhythmias. At minimum, you need to check ionized calcium before proceeding." For a moment, Aldridge just stared at her. Then his expression shifted from cold to something approaching contempt. "You are seriously standing here, a nurse with what? 2 years of experience in some rural clinic, telling me, a board-certified surgeon with 7 years of advanced training, that I misdiagnosed a patient? I am suggesting an additional workup before irreversible. Based on what? Your intuition? Your feelings? This is a teaching hospital, Nurse Winters, not a faith-healing center. We practice evidence-based medicine here. Henderson's clinical picture is classic for intra-abdominal infection. His labs support that diagnosis. Imaging supports that diagnosis. Every physician who has examined him agrees. But you, with your gut instinct and your Google searches, think we are all wrong." Noelle felt heat rising in her cheeks, but kept her voice steady. "I am not relying on intuition. I have documented evidence in his chart, case studies showing similar presentations, and a clear pharmacological pathway from his supplement regimen to his current symptoms. All I am asking is that you order one additional lab test before proceeding. If I am wrong, the surgery proceeds with minimal delay. If I'm right, you avoid a potentially fatal mistake." "If you are right," Aldridge laughed, but there was no humor in it. "Let me tell you something about clinical medicine, Nurse Winters. It is not about hunches and Hail Mary lab tests. It is about systematic assessment, differential diagnosis based on probability, and decisive action. Yes, hypercalcemia can mimic infection. It is also extremely rare in the absence of specific risk factors Henderson does not have. The odds that every trained physician here missed it while you, with your limited experience, caught it. Astronomical. Do you understand what would happen if I delayed surgery every time someone had an unlikely theory? I understand what will happen if you do not check and I am right. Then you understand nothing about how medicine works." He stepped around her, his voice rising enough that everyone in the corridor could hear. "This is exactly the problem with modern nursing education. They teach you just enough to be dangerous, give you access to databases you do not have the training to properly interpret, and suddenly everyone thinks they are qualified to override physician judgment. You want to practice medicine, Nurse Winters? Go to medical school. Until then, stay in your lane." He strode away, leaving Noelle standing in the hallway with burning eyes and trembling hands. Around her, people carefully avoided eye contact, hurrying about their business as if nothing had happened. She heard whispers, saw sidelong glances. The new nurse who had challenged Dr. Aldridge. Who did she think she was? Raymond appeared at her elbow, his face tight with suppressed anger. "I heard all of that. He was out of line. He is also about to operate on a patient who might die because I could not make him listen." "You tried. That is all you can do. Document everything. Report to the charge nurse and the nursing supervisor. Cover yourself legally and ethically. Then you have to let it go. You cannot force a physician to order a test they are convinced is unnecessary." But Noelle could not let it go. She watched the clock as it ticked toward the scheduled surgery time. She reviewed Henderson's chart again, triple-checking her reasoning, finding nothing to make her doubt her conclusion. She tried reaching the patient's family, but they were already in the surgical waiting room, putting their faith in Dr. Aldridge's expertise. She prayed. Not flowery words or formal requests, just honest pleading. "Please, please let me be wrong. Or please, if I am right, let someone else see it. Please do not let pride, mine or his, cost this man his life." The surgery was scheduled to begin at 9:30. At 9:15, all hell broke loose. The hospital's emergency alert system activated with a series of sharp electronic tones that made everyone freeze. The overhead speakers crackled to life with the emergency coordinator's strained voice. Code triage, code triage. Mass casualty incident, industrial accident at the Riverside chemical plant. Multiple patients incoming with burns and possible toxic exposure. All available personnel report to emergency department immediately. Code triage, code triage. The announcement repeated 3 times. Before it finished, doctors and nurses were already running, pulling on protective gear, converting procedure rooms into additional treatment spaces. The entire hospital shifted into crisis mode with practiced speed, a choreographed response to the unthinkable. Noelle ran with the others, her personal crisis instantly replaced by something much larger. The emergency department became a controlled chaos of incoming ambulances, screaming sirens, patients on stretchers with burns and blood and chemical contamination. The smell hit her first, a toxic mixture of burned flesh and industrial solvents that made her eyes water even through the protective mask. "Burns, mostly 2nd and 3rd degree," a paramedic shouted over the din. "At least 40 patients incoming. Plant's cooling tower ruptured during maintenance. Released superheated steam and unknown chemicals. We have people coated in caustic materials, others with severe thermal injuries, several with respiratory distress from inhalation." Noelle found herself assigned to triage, rapidly assessing each patient as they arrived, directing them to appropriate treatment areas based on severity. Her training in the rural clinics proved invaluable now. She had seen disasters before, had learned to think fast with limited resources, to prioritize when everything felt urgent. Dr. Aldridge arrived in the emergency department 7 minutes after the first patient, his surgical scrubs hastily covered with a protective gown. Whatever else he was a skilled physician who did not hesitate in crisis. He immediately took command of the most critical cases, his hands steady, his voice clear over the chaos. "Chemical burns take priority over thermal," he shouted to the assembled staff. "We need to identify the substance and start appropriate irrigation immediately. Anyone with respiratory symptoms gets fast-tracked to the ICU. Set up decontamination protocols for all incoming patients. Move, people, move!" Noelle worked alongside him, their earlier confrontation forgotten in the urgency of saving lives. She held pressure on a woman's bleeding arm while Aldridge assessed her burns. She helped position an elderly man for intubation when his breathing became labored. She retrieved emergency equipment, anticipated needs before they were spoken, fell into the rhythm of coordinated emergency care. For 2 hours, they worked without stopping. Patients kept arriving. The hospital's supply of burn dressings and specialized medications began running low. Someone made the decision to cancel all elective surgeries and redirect all resources to the emergency. Mr. Henderson's operation was postponed indefinitely. Then, at 11:47, something changed. Dr. Aldridge was examining a middle-aged man with chemical burns across his back and arms, determining whether he needed emergency surgery for compartment syndrome. As he bent over the patient, checking pulses in the swollen limbs, he suddenly swayed. His hand went to his head, and Noelle saw confusion flash across his face. "Dr. Aldridge?" She moved closer, concerned. "I am fine," he said, but his voice lacked its usual certainty. "Just stood up too fast, probably the heat from all these protective layers." But 3 minutes later, it happened again. This time he had to grab the edge of the gurney to steady himself. His face had gone pale beneath the sweat, and Noelle noticed his hands trembling slightly. "Dr. Aldridge, you need to sit down." "I said I am fine, Nurse Winters. We have patients." He stopped mid-sentence, blinking rapidly. "Why is the room spinning?" Raymond appeared at her other side, having seen what was happening. Together, they guided Aldridge to a chair in the corner of the treatment area. He did not resist as strongly as Noelle expected, which worried her more than anything else. When did you last eat or drink? Raymond asked, checking his pulse. I do not remember. Before the first surgery. Maybe 6 this morning. Water, I think. Aldridge's words were slightly slurred, another concerning sign. You have been going non-stop for 6 hours, some of it in a hot OR. You are probably dehydrated and hypoglycemic. We will get you fluids and— Wait! Aldridge touched his face, his fingers coming away wet. I am sweating, but I feel cold. That does not make sense. He looked at his hands, flexing them as if they belonged to someone else. And my hands feel strange, numb, tingling. Noel and Raymond exchanged glances. Those symptoms went beyond simple dehydration. What else are you feeling? Noel asked, kneeling in front of him to make eye contact. Any nausea, headache, chest pain? All of the above. And— He paused, his analytical mind still working despite the confusion. Muscle weakness, profound muscle weakness. I can barely lift my arms. Did you get exposed to any chemicals during the triage? Splashed with anything? I do not think so. I have been wearing full protective gear the whole time, and I feel tired, not burned. This is different. His eyes widened slightly as another thought occurred to him. My heart, it feels irregular, like it is skipping beats. That changed everything. Raymond immediately called for an EKG machine, while Noel placed her fingers on Aldridge's wrist, feeling the pulse. It was rapid and definitely irregular, with occasional dropped beats that made her blood run cold. We need to get you examined properly, she said, trying to keep her voice calm. Right now. No, I am needed here. Just give me a minute to— He tried to stand and immediately collapsed back into the chair, his legs unable to support his weight. Fear flickered across his features, the first real fear she had seen from him. What is happening to me? The EKG machine arrived, and Raymond quickly attached the leads to Aldridge's chest. The screen showed what they had already suspected. Severe cardiac arrhythmia, the kind that could rapidly progress to something fatal. We need to get him to a monitored bed immediately, Raymond said. But as he spoke, the overhead lights flickered once, twice, then went out completely. Emergency lighting kicked in a second later, casting everything in harsh shadows. Power failure! Someone shouted from across the emergency department. Backup generators should engage in 30 seconds. But 30 seconds passed, then 45, and while the emergency lights remained on, the main power did not return. More concerning, the ventilators and monitors began switching to battery backup, their alarm systems activating across the department. Generator is not engaging. The emergency coordinator's voice came through on the backup communication system. Engineering is on it, but we have no estimate for restoration. All departments initiate battery backup protocols. Prepare for manual ventilation if necessary. The timing could not have been worse. They had dozens of critical patients requiring powered equipment, and now Dr. Graham Aldridge, the physician leading the emergency response, was having a medical crisis of his own, with limited diagnostic tools available. In the dimmed emergency lighting, surrounded by chaos and uncertainty, two realities collided in Noel's mind, with perfect clarity. First, Dr. Aldridge needed help immediately, the kind of help that would normally require extensive testing and multiple specialists. Second, in these conditions, with power out and resources stretched impossibly thin, traditional diagnostic pathways were not available. She made a decision. Raymond, I need you to trust me. I know what is wrong with him. Aldridge looked up at her through eyes that were beginning to glaze with confusion. You know, what is happening to me? How could you possibly— Because I spent 2 years in clinics where we could not run tests for every symptom. We had to observe, listen, put pieces together with limited information. And right now, we do not have time for the full workup you would normally get. Your cardiac rhythm is destabilizing, your neuromuscular function is compromised, and without power, we have extremely limited treatment options. So I need you to do something you have never done before, Dr. Aldridge. I need you to trust a nurse who has been exactly where you are right now. The corridor outside the emergency department had become a staging area for supplies. Battery-powered equipment lined the walls. Medical staff moved with urgent purpose, their faces illuminated by emergency lighting that cast stark shadows. And there, in that improvised space, Noel Winters knelt before the arrogant doctor who had dismissed her, holding his weakening pulse between her fingers, feeling the erratic rhythm of his failing heart. Behind them, the organized chaos of the emergency response continued. A woman sobbed as she was separated from her burned husband. Someone shouted for more plasma. An alarm sounded from a patient whose ventilator battery was running low. The smell of chemicals and fear hung heavy in the air. But in that moment, in that small corner of crisis, everything narrowed to two people locked in a desperate choice. A doctor who had built his identity on being the smartest person in every room, now vulnerable and terrified. A nurse who had been invisible until the moment when only her eyes could see what everyone else had missed. "Tell me," Aldridge whispered, his voice barely audible over the surrounding noise. His pride was there still. She could see it in his eyes, warring with the reality of his condition. But beneath it, finally, was something more powerful. Fear. And with fear, the first crack in the walls he had built around his certainty. Noelle took a breath, gathering her thoughts into the clearest possible explanation. She had one chance to make him understand, one moment before his condition deteriorated, past the point where her diagnosis would matter. "You are experiencing acute poisoning, Dr. Aldridge. Not from the chemicals in the emergency department. From something you encountered earlier, before the crisis started. I need you to think carefully. In the past 4 hours, what did you consume? Any food, any drink, even something as simple as an antacid or vitamin supplement?" His brow furrowed with effort. There was coffee, this morning, from the cafeteria, and..." He paused, memory surfacing through the mental fog. "An energy drink, from the vending machine by the surgical lounge. I was tired from the first surgery. I thought the caffeine would help me stay sharp for Henderson's procedure." "What brand? Do you remember?" "Local brand. Something Thunderbolt, Lightning Strike. I do not remember exactly. It was green. Had some herbal ingredients listed. Why does that matter?" His words were coming slower now, each sentence requiring visible effort. Noelle's mind raced through possibilities, fitting pieces together at speed. Rural clinics meant seeing herb-related complications that urban hospitals rarely encountered. It meant understanding how traditional remedies and modern supplements could interact in dangerous ways. It meant knowing that not all poisoning came from obvious sources. "The chemical plant that exploded," she said, looking at Raymond. "What chemicals were they working with when the cooling tower ruptured?" "I heard someone say calcium hypochlorite, and some kind of industrial cleaner." "Why?" "Because calcium is the common factor. Henderson with his calcium supplements causing hypercalcemia. Now Dr. Aldridge with symptoms that look remarkably similar, but with an acute onset. Confusion, muscle weakness, cardiac arrhythmia, nausea." She turned back to Aldridge. "Those energy drinks, especially the ones made locally with herbal ingredients, sometimes contain massive amounts of calcium and vitamin D, particularly the ones marketed to shift workers and medical professionals. I've seen this before in a patient who collapsed after drinking 3 of them in one shift. The symptoms match perfectly." Aldridge tried to shake his head, but the movement was sluggish. That is impossible. Energy drinks do not cause acute toxicity. You would need massive amounts, not if you are already slightly depleted from working long hours with inadequate nutrition. Not if the particular brand has higher concentrations than listed on the label, which happens more often than people think with unregulated supplements. Not if your body is already stressed from surgery, from dehydration, from the physical demands of emergency work, and definitely not when you consider what happens to calcium metabolism under those conditions. Raymond was already moving, understanding where she was going. If he has severe hypercalcemia, we need to get fluids into him immediately. Saline, aggressive rehydration, and we need to check his ionized calcium level, Noel finished. Except the lab analyzers require main power, which we do not have. So we need to treat empirically based on clinical diagnosis, and we need to do it right now before his heart rhythm deteriorates into something we cannot fix with the equipment we have available. You want to treat me for hypercalcemia, Aldridge said slowly, based on a theory about energy drinks and circumstantial evidence, without laboratory confirmation, in the middle of a disaster response, with limited resources. Yes. And if you're wrong, if this is something else entirely, if it is cardiac ischemia or sepsis or a dozen other conditions that present with similar symptoms, then the fluids will not hurt you and might help until we can get power restored and run. Improper tests. But Dr. Aldridge, I'm not wrong. I know what I am seeing. The same way you know when a patient has appendicitis before the CT confirms it, or when someone is about to crash before the monitors show it. Experience and observation, trust and instinct. She paused, holding his gaze, letting him see her certainty. You have spent your entire career being the smartest person in the room. But right now, in this moment with this specific problem, I have seen more of this than you have. Not because I am better educated or more talented, because I have been in places where we did not have the luxury of confirmation before we acted, where we learned to see patterns and trust our judgment because waiting for perfect information meant watching people die. The words hung between them, truth delivered without softening. Around them, the emergency department continued its desperate choreography. But here, in this corner, time seemed suspended, waiting for a choice. Aldridge's hands were shaking visibly now. His lips had taken on a bluish tint that Noel recognized as an ominous sign. Every second they debated was a second his condition worsened. His heart, flooded with excess calcium, could seize at any moment. Cardiac arrest in a hospital without power, without proper equipment, with all resources diverted to other emergencies, was often fatal. He knew this. She could see the calculation in his eyes, the physician's instinct warring with the man's pride. "If I let you do this," he said finally, each word deliberate, "if I trust your diagnosis over my own doubt, and you are right, that means I was wrong about Henderson. Completely wrong. It means I would have killed him if the emergency had not delayed his surgery. It means I was too arrogant to consider a legitimate diagnostic possibility, because it came from a nurse instead of another physician." "Yes," Noel said simply, "it means all of that. And you are asking me to face that truth while my heart is failing and I am terrified and vulnerable in ways I have never been before in my professional life. I am asking you to let me save your life, Dr. Aldridge. The rest is secondary." For several heartbeats he said nothing. Then slowly he nodded. "Do it. Whatever you think I need. I am trusting you, Nurse Winters. Please do not let me die." The words were the hardest he had ever spoken, and Noel heard the weight of surrender in them. Not just surrender to treatment, but surrender to the possibility that his certainty had been misplaced, that his dismissals had been wrong, that someone he had considered beneath his notice had seen what he had missed. Raymond was already moving, grabbing supplies from the emergency cart. Starting 2 large-bore IVs, normal saline wide open. I will push him as fast as his heart can handle. What else? Furosemide to help flush the calcium through his kidneys. And we need to slow his heart rate down before the arrhythmia converts to something lethal. Beta blocker, but carefully. His blood pressure is probably already dropping with the fluid shifts. Noel continued her assessment, her training taking over. Get the portable defibrillator ready just in case, and someone needs to manually ventilate that patient in room 3. His vent battery just died. The next 20 minutes were a blur of controlled emergency. Noel coordinated Aldridge's treatment while simultaneously helping manage the other critical patients around them. She watched his cardiac monitor like a hawk, noting every change, adjusting treatment based on clinical response rather than lab values she could not obtain. She held his hand when a particularly severe arrhythmia made him gasp in fear, and she spoke to him calmly about what was happening, keeping him oriented as his body fought the chemical imbalance threatening his life. Gradually, incrementally, he began to improve. His heart rhythms stabilized, his confusion cleared enough that he could speak coherently. His muscle strength returned in small waves, first his hands, then his arms, finally his legs. The color came back to his face, replacing the grey pallor of cardiac compromise with something closer to normal. When the main power finally restored 47 minutes later, flooding the emergency department with bright lights and the sounds of equipment powering up, Dr. Graham Aldridge was sitting up on a gurney, weak but stable, with 3 liters of saline and 2 doses of diuretic having flushed the excess calcium from his system. His cardiac monitor showed normal sinus rhythm. His oxygen saturation was good. He was going to survive. The portable lab analyzer was brought to him immediately, and the ionized calcium level came back exactly as Noel had predicted. Critically elevated, but responding to treatment. Dangerously high enough to have caused exactly the symptoms he had experienced, and high enough to have caused fatal arrhythmia during anesthesia if he had proceeded with surgery that morning. Aldridge stared at the lab result for a long time, saying nothing. "Dr. Aldridge," Raymond ventured carefully, "we should get you admitted for observation, at least overnight. You are stable now, but—" "Mr. Henderson," Aldridge interrupted, his voice rough. "His calcium level. Someone needs to check it immediately." "Already done," Raymond said. "I sent the order as soon as power came back up. Results should be here any minute." They were. And they confirmed what Noel had documented in her nursing notes 20 hours earlier. Severe hypercalcemia, high enough to mimic sepsis, high enough to make surgery extremely dangerous, high enough to require immediate treatment with fluids and medication, and nothing else. No infection, no need for antibiotics or emergency exploration, just calcium, invisible without the specific test, potentially fatal without the right diagnosis. In the span of one catastrophic day, 2 men had nearly died from the same condition. One because his doctor was too arrogant to consider an alternative diagnosis. One because he was that doctor, and the universe had delivered the same lesson he needed to learn directly into his own body. The emergency department gradually returned to normal operations. The critical patients from the chemical plant were stabilized and distributed to various units. The power held steady. The crisis passed into the realm of paperwork and after-action reports. Staff members who had worked for hours without break finally took moments to breathe, to process, to begin the emotional decompression that followed every disaster. Noel found a quiet corner in the staff lounge, her hands wrapped around a cup of coffee that had gone cold without her noticing. Her body ached with exhaustion. Her mind replayed the day's events in disconnected fragments, unable yet to process it all coherently. The door opened quietly, and Dr. Aldridge entered. He had changed out of his protective gear into clean scrubs, though he still wore the IV catheter in his arm, taped securely for the continued hydration the internist had insisted on. He moved slowly, carefully, like someone who had been reminded of his own mortality and was not yet ready to trust his body fully. "Nurse Winters," he said, then stopped, seeming uncertain how to continue. Noel looked up at him, too tired for pretense. "Dr. Aldridge, you should be in a monitored bed. I should be many things." He sat down in a chair across from her, moving with the cautious deliberation of someone who had been very sick very recently. "I came to say, that is, I wanted to—" He paused, and she saw him struggling with words that did not come easily. "You saved my life today. I did my job. Any competent nurse would have done the same." "No." His voice was firm, requiring her to meet his eyes. "Any competent nurse would have assessed my symptoms and called for help. You went further. You made a diagnosis that required you to synthesize information from multiple sources, to trust your own judgment over conventional wisdom, and to act decisively without confirmation. That is not nursing. That is clinical reasoning at the highest level. And he took a breath, the words clearly difficult. I dismissed you repeatedly, rudely. I ignored your valid concerns about Henderson. I told you to stay in your lane. I made assumptions about your competence based on credentials rather than ability. And I was wrong. About all of it. Noel said nothing, letting him finish. If you had not been there today, I would have died. Not immediately, but within the hour. My heart would have arrested. And in the chaos of the disaster response, I would have been just another code, just another victim. Instead, you saw what was happening. You made the right diagnosis under impossible conditions, and you treated me based on clinical judgment because we did not have the luxury of waiting for lab confirmation. You did exactly what I have been trained to do, and you did it better than I could have in that moment because you had experience I lacked. He leaned forward, his elbows on his knees, his face showing a vulnerability she had never expected to see. Henderson would have died on my operating table this morning. I would have opened him up, found nothing that needed surgical intervention, and he would have arrested under anesthesia from the hypercalcemia. His death would have been on me. Because I was so certain I knew better, so convinced of my own expertise, that I would not even consider the possibility that someone else might see something I missed, especially not someone I had already decided was not worth listening to. Dr. Aldridge, Graham, please, I think after today we can dispense with excessive formality. He smiled slightly, but it was strained, shadowed by the weight of what he was acknowledging. I have been thinking about something you said. About experience and observation, about learning to see patterns and trust your judgment. I realized I have been practicing medicine in an environment where I always had confirmation available, where I never had to rely purely on clinical assessment because I could always order another test, consult another specialist, wait for more information. It made me confident, but it also made me limited, rigid, unable to recognize excellence that came from a different path than my own. He stood up slowly, wincing slightly, and extended his hand to her. I am sorry, Nurse Winters. Noel, not just for today, though today certainly highlighted my failures, but for every time I dismissed input from nursing staff, every time I treated nurses as subordinates rather than colleagues, every time I let my credentials blind me to the reality that healing requires humility, collaboration, and the wisdom to recognize that the person with the right answer is not always the person with the most degrees. Noel took his hand, feeling the tremor still present from his recent crisis. Apology accepted, Graham. And for what it is worth, you are a brilliant surgeon. Today does not change that. It just means you have room to grow in other areas. We all do. Some of us have more room than others. He released her hand, but did not move away. I am going to make changes, starting with properly reviewing Henderson's care with the full team, acknowledging the diagnostic error, and implementing a protocol where nursing concerns are formally addressed rather than casually dismissed. I am also going to recommend you for recognition from the hospital board. What you did today, both in catching my error with Henderson and in diagnosing and treating my crisis, represents clinical excellence that should be acknowledged. That is not necessary. It is absolutely necessary, not as charity or compensation, but because you earned it. And because I need to start practicing what I'm now preaching about valuing contributions regardless of their source. He glanced at the clock on the wall. I should let you rest. You worked twice as many hours as anyone should have today. But Noel, thank you for seeing what I could not see, for having the courage to speak up even when I made it clear your voice was not welcome, for not giving up on Henderson or on me, even when it would have been easier to stay silent. After he left, Noel sat alone in the quiet lounge for a long time. Eventually, she pulled out her journal and added a new entry, dating it carefully. The words came slowly, each one chosen with the weight of experience behind it. Today, I learned that pride wounds before it kills, and that sometimes the greatest healing happens in the space where certainty meets humility. A man who thought he knew everything learned he did not, and in that moment of surrender, found wisdom he had been missing. I learned that speaking truth to power requires courage I did not know I possessed, and that staying faithful to what I know to be right matters more than being comfortable or accepted. I learned that competence takes many forms, and that the most valuable medicine is sometimes not in the diagnosis or the treatment, but in the willingness to listen when someone says, "I might be wrong." Most of all, I learned that grace offered in crisis changes both the giver and the receiver. I saved his life, yes, but he gave me something too, validation that my voice matters. Proof that experience earned in humble places can be just as valuable as credentials earned in prestigious ones, and a reminder that the work we do, the vigilance we maintain, the courage to speak up when others might stay silent, all of it matters. All of it saves lives. All of it serves something greater than ourselves. 3 weeks later, Mr. Henderson was discharged from the hospital, fully recovered after treatment for severe hypercalcemia. The investigation into his supplements revealed that the calcium carbonate tablets he had been taking were misformulated, containing nearly 3 times the stated amount per dose. A manufacturer recall followed. Other patients were identified and treated before they developed life-threatening complications. Dr. Graham Aldridge returned to full duty after a week of monitoring and gradually reducing calcium levels. He instituted monthly teaching rounds where nursing staff presented interesting cases, and he made a point of introducing himself to every new nurse on the floor, asking about their background and experience rather than assuming he already knew their capabilities. When he saw Noelle in the hallways now, he stopped to ask her opinion. He listed her as co-author on a case study about hypercalcemia presentations in acute care settings. He recommended her for the advanced practice nursing program when she mentioned considering further education. He never forgot the lesson his own body had taught him in a single day. That wisdom comes in unexpected packages. That humility is not weakness, but strength. That the person who saves your life might be the same person you dismissed yesterday. And that grace, freely given when we least deserve it, has the power to transform everything. Noelle kept the energy drink can that had nearly killed Dr. Aldridge. She placed it on a shelf in her apartment, a reminder that the most dangerous poisons are often the ones we consume willingly, thinking they will make us stronger. Pride, certainty, the belief that we have nothing left to learn from those we consider beneath us. Sometimes salvation comes not from those who look the most qualified, but from those who have learned to see clearly because they had no choice. From those who trust their observation because they have been forced to rely on it. From those who speak quietly but with conviction, who refuse to be silenced even when their voice is unwelcome, who understand that true healing requires more than technical skill. It requires the courage to say, "I might be wrong," and the grace to listen when someone else says, "Let me help you see what you have missed." In the end, that was the real miracle of that terrible, transformative day. Not that lives were saved, though they were. Not that errors were caught before they became fatal, though that mattered. But that in the space between pride and humility, in the moment when one person's certainty crumbled and another's quiet confidence held steady, something fundamental shifted in the way two people understood their place in the great work of healing. A doctor learned to listen. A nurse learned her voice had power. And in a pristine hospital corridor, where lives hung in the balance every single day, where equipment hummed and hearts beat, and humans struggled with the eternal question of how to help without harm, the truth rang out clear as bells. We need each other, all of us, with our different gifts and varied experience and unique perspectives. There is no hierarchy in wisdom, only in the willingness to receive it. The rest is just detail, just noise, just pride dressed up in credentials and refusing to admit what every person who has ever truly healed another already knows in their bones. That humility is where healing begins. That listening is more powerful than speaking. And that the greatest diagnostic tool any physician or nurse will ever possess is the simple, profound willingness to consider that they might not have all the answers, and that the person standing beside them, dismissed and undervalued and easy to ignore, might be the one who sees what everyone else has missed, might be the one who saves their life, might be the one who changes everything.